I've been working in Lambeth and Southwark for nearly 15 years now, and I love working with such a vibrant and diverse community. We know that across South East London we've got some really excellent health services, but we also know there's a lot that we could do to improve them. We think that by working across the 6 boroughs together, we can learn from each other and achieve more.
At the heart of the South East London programme is improving the offer to our people. A more immediate, more local, more comprehensive, more friendly and personal offer to the people in our communities.
I'm Ros Luff. I'm a patient and public representative on the advisory group for our Healthier South East London programme. I've got a wealth of experience of caring for a child myself with disability. Sometimes our families fall between 2 stools. It may be that they receive health care services and then that stops and there's no social care. Sometimes it can be a bit of a maze to get to those services for our children. So we just want to work together to make those improvements get the best that we possibly can in the landscape that we're in.
I'm John King. I retired from medical profession 5 years ago. For 30 years I've been a patient of the NHS, and for the last 4 years I have been a patient representative. Medicine now is very much a case of cooperation between patient and doctor. They're part of a team.
I'm Shri Kaladindi. I'm a consultant psychiatrist at the South London and Maudsley Trust. It's absolutely imperative that for those who have mental health conditions that we properly attend to their physical health care too, and through the whole integration programme that is something that I very much want to improve. Some of the exciting things I think about this integration work is really focusing far more perhaps than we've been able to before in prevention, so getting in early and thinking about what are those factors that we can change that really help people to reduce their risk of becoming unwell.
The communication and continuity in some parts of my care is excellent, and it is so reassuring for me to know that they are working closely together. I'd like to see this throughout it all. I feel with some imaginative planning it would be possible to have a specially trained carer who could provide all my support. This would also free up district nurses to focus on providing medical support in the community, maybe combining their budgets too.
In South East London, we have some incredible world-renowned services. Unfortunately, that's not the case throughout the whole patch. There is variability. What we want is for all the services to be lifted up to that high level so that wherever you are, whether you're accessing community or hospital services, that you can expect that world-class standard.
I live to tell my story. I'm in remission, 5 years in May. When I first got diagnosed, I didn't think I would survive it. I'm grateful for all the doctors and nurses who looked after me within the NHS. Every patient's voice matters, and you can only get a system right if you get the people who actually are part of the system. Let them give you feedbacks how and what they went through. NHS is our system and it's for all of us, and we all need to get involved. I don't think it will work if we think the bosses in the office sit there and write the system out and it will work. We as patients need to get involved, the public needs to get involved, everyone needs to get involved, and we'll have a better NHS.
If we're to give people the sort of health service they want for the future, one that joins up care, one that helps to support them manage their own illness, and one that prevents ill health and disease, then we're going to need a very different workforce, and they're going to require a whole different skill set.
We have spent a lot of time listening to patients, carers, and the staff who provide your care to hear what you have to say about what you want from the system that we all share. What we all want is that all the staff are communicating and coordinating your care so that it is absolutely seamless from the beginning to the end.